Welcome to Medicine, Motherhood, and Missions, the podcast where we dive deep into impactful and inspiring conversations with amazing professionals who've turned their challenges into stepping stones for success. I'm Johanna, your host, and each time we meet, we'll explore the stories and journeys of remarkable individuals who are PAs, doctors, professionals, mothers, and mission-driven changemakers, from the halls of the hospitals to the hearts of our homes, and into the communities we serve. Join us as we uncover the challenges, triumphs, and everything in between and see life through each other's perspective. If you're seeking fulfillment in your career and life, I've got something special for you too. Download our free guide on how to be a fulfilled provider. It's packed with tips and insights to help you thrive while balancing the many hats you wear. And for all those parents out there dreaming big while raising little ones, check out Little Evie's Big Dreams children's book series, available now on Amazon. These heartwarming stories inspire kids to chase their own dreams, just like you're chasing yours. So grab your favorite cup of coffee or tea, settle in, and get ready for uplifting conversations that will leave you inspired and equipped to make a greater impact. Let's jump in. Hi, friends. I'm so excited to have on the podcast today Dr. Hannah Hamlin. And it's going to be a very interesting conversation on chronic disease, diabetes, mindset, and really excited about today's conversation. Dr. Hamlin, her interest in medicine stems from personal experience as she herself grew up as a patient with type 1 diabetes. She believes that her experience as a patient gives her a unique perspective on what it feels like to receive care in a chronic disease model. Her approach to care centers around a patient's quality of life and healthcare goals. She brings her insight and knowledge to assist patients in decision-making about medical therapies and mindset choices. She has a background in nutrition and is a board certified in advanced diabetes management by ADCES. And so thank you so much, Hannah, for joining us today. How are you doing today?
I'm doing great. I'm excited to be here.
Thank you. So tell us a little bit about yourself and how you got to this point in your journey.
Sure. Yeah, I appreciate you reading the intro. It's always funny to hear it reflected back. And really, that is part of how it started, was kind of growing up as a patient and having a lot of questions about health and how to feel good and live with a chronic disease in a way where it felt empowering and I wasn't focusing on health all the time. But then also I had a lot of questions about how to actually get the health goals that I wanted to have. And so my interest in medicine started with nutrition, just a lot of questions about food after being diagnosed with diabetes as a teenager.
Yeah.
And then learning more about nutrition and health, I was able to kind of decide that medicine was something I wanted to do in college. And then kind of going through, learned a lot about different options. I feel like in medicine, there are so many paths for us to follow to get to different places. And navigating that was really interesting, I think, because I carried the patient perspective with me as I went through. So just really wanting to put myself in a place where I had longer appointments with patients and I was able to answer questions that weren't just medication-based, but also lifestyle and mindset, mental health-based. And so that's kind of the overall journey that brought me to where I am, which is working in a clinic where I do get those longer appointments with people. And my training is a little bit non-traditional because I have a lot of the lifestyle medicine background and then diabetes specific, if that makes sense. So
yeah, because you're primarily in internal medicine and you work in direct primary care, right?
Actually, a little bit different than that. So what I decided to do when I was in medical school, really wanted to help people with diabetes. And the traditional path is to kind of go two ways. Like you said, one is internal medicine, where you treat only adults with diabetes if you were to go on to endocrinology.
Right.
And the other is to become a pediatrician and then do a fellowship in endocrinology, and then you become a pediatric endocrinologist. So you just treat children with diabetes and other endocrine disorders. And I had a really hard time deciding between the two. Initially, I thought I would go internal medicine and become an endocrinologist, but I really wanted to be more holistic in what I could offer a patient. So not just looking at the endocrine disorder, just the diabetes piece, but more full health. I had a lot of questions as a patient
Mhm.
where it would be my periods impact my blood sugar. What should I do? And then I get referred
Right.
to OB/GYN, or I've got the flu and my blood sugars are harder to manage. What do I do? And then you go to primary care, and it just felt like I needed someone to help me with my diabetes and the rest of my body at the same
Yeah.
time, because it was so intertwined.
Uh-huh.
So I decided to do a family medicine residency, and I got
Okay.
a year into that. So I
Uh-huh.
did one internship, and I just decided that I didn't think I wanted to do acute care, full
Right.
family practice. And so I
Mhm.
left as a general practitioner. I got my Texas license, and then I went on to study integrative medicine and got certified there. And then the advanced diabetes management board certification through the diabetes educators
Okay.
board. So not a traditional American board.
Right, right.
And so
Yeah,
very
yeah.
different. Yeah, it's hard to
Okay.
interpret.
Okay. So that's good to know and kind of understand um, exactly what you're specializing in, and that's so true because I know some people and some friends who started doing marathon running, and they always or they have commented on if they're diabetic and type 1 diabetic, how that affects their blood glucose levels, and should they carb up, or what should they do, things like that. So do you get questions like that, just throwing that out there too?
Yeah,
Like with like
absolutely. It's amazing. And this is one of those pieces I kind of referenced in the beginning. I learned so much
mm,
through my own experience as a patient with diabetes.
mm,
It's amazing what can impact blood sugar. Exercise,
yeah,
even just walking my dogs well, certainly running a marathon, but also
yeah,
things like stress and excitement
mm,
and sleep can make a big difference. So yes, we talk about all of those things because
yeah,
they really change how you have to dose your insulin medication,
yeah,
because your insulin sensitivity can
mm,
change throughout the day, definitely throughout the month, different chapters of life. So yes, we talk about
yeah,
those things, and food's really
yeah,
important to understand because it's
mm,
half of the equation to balancing blood sugar. So.
yeah, yeah. And so when did you first get diagnosed with insulin dependent diabetes?
So, yeah, I was diagnosed with type 1 diabetes when I was a teenager. I was just a
Okay.
few weeks away from turning 13.
Oh, wow.
And we lived, kind of moved around a lot growing up, but we had lived overseas and moved back to the US. And about 6 months later, I was diagnosed. So often people will ask, do you know what your trigger is? Some people, it's
Mhm,
pretty clear. They had a really rough flu, and a couple,
mhm,
months later or weeks later, their type 1 diabetes came on, some type of
mhm,
epigenetic trigger from the
uh-huh,
environment. But for me, everything had changed. My exposure to different viruses and diseases, my food quality is very different here than in the UK where I used to live.
mhm.
It was a big stressor to move in middle school and be
Right.
awkward and try to make friends.
Yeah,
It was so different. So who
yeah.
knows for me? But yeah, I was 13.
Okay. So you've been dealing with it for quite a while. And
Mhm.
as a 13-year-old, a young child just, in middle school, and middle school itself is so full of changes and emotional struggles and all sorts of things, and then now you throw this type 1 diabetes on top of it all, and it's going to be lifelong. How did that impact your mindset and your life at that moment?
I love this question because it's so hard to fully explain until you experience something like that. I think that's,
Yeah.
of course, death of a
Mhm.
loved one, or, these big events that happen in life to us. It's
Yeah.
really hard to put into words. But I went through kind of almost stages of grief, like you would,
Mhm.
from a big traumatic event. And in the beginning, I was completely in denial. I didn't want to
Yeah.
learn about it. I didn't want to talk about it. I didn't want to do the things I needed to do. I think just that fight, flight, freeze response, I kind of got stuck in the freeze for months, honestly.
Uh-huh.
Didn't want to tell any of my new friends, of course.
Mhm.
I remember
Yeah.
vividly my mom having to give a letter to all my teachers so they would understand, that I
Oh,
could
yeah.
leave to go to the nurse if I needed assistance. And
Mhm.
I was so terrified to give my teachers this letter because then they would know. And it was this big secret that I had. And I was so worried about how people would perceive me or judge me
Mhm.
or think that I was broken, or, all these limiting beliefs that come up
Right.
when you don't fully understand something. And I
Mhm.
didn't really know at the time what it meant for me lifelong. I think
Mhm.
when you're 13, you can't really grasp like
Yeah.
So I just knew it was something I didn't want to have and I didn't want to talk about. And that lasted months. And then finally my parents made me go to a camp for kids with type 1 diabetes. And I really didn't want to go, but they dropped me off and it completely changed my life. I
Mhm.
got to meet other kids and learned how they processed it and dealt with it and
Mhm.
felt about it and talked about it, how they
Ah,
were able to tell their friends. And, just all of that made me feel like, okay, I can do this too.
yeah.
But it really took kind of throwing me in that environment before I was ready to accept it.
Wow, that's so fascinating that they have camps specific for kids with type 1 diabetes. I love that. Because, I mean, what better way than have like that community support to get through such a huge milestone?
It
Um,
really, yeah, it's amazing. And
mhm.
now I'm a medical director of one, I volunteer at another, and
Oh,
they're a
wow.
big part of my life still because
Yeah.
you're right. It's that community that's transformative. Yeah.
Yeah.
So it's
How did
amazing
you,
what kids go through every year. Sorry, I didn't
yeah.
mean to cut you off
No.
there.
Yeah. So, how did you hear about it? Because that would be something like maybe listeners, if they have kids or things that, want to know about those types of camps. How do you hear about those kinds of camps and community connections?
Yeah. Typically, they're in most states, these type 1 diabetes specific camps.
Mhm.
Usually, the pediatric endocrinologist will kind of have a list of the ones in the area. So I'd say start with your own doctor.
Okay.
The American Diabetes Association has some approved camps that they'll list on their main website. You can kind of search
Mhm.
for them there. But really, just asking around, you can kind of find out. I'm sure by a quick Google search of your state or your city or the city you're
Right.
closest to.
Mhm.
And there's a huge variety. Some are completely free, some are subsidized, some are higher cost. There's I think in Texas I can think of 3 that are just a couple hours from me. So
Okay.
it's nice that there seems to be it seems to be
Mhm.
something that's kind of taken off across the country.
Yeah, that's awesome, and that's such a great asset to have. And given when you were young, you had it, so that's it's been a while. It's been around for a little bit.
Hmm.
Yeah,
Yeah.
and so how did that impact the way you practice medicine? I know you mentioned a little bit about that in your thought process of choosing specialties and even thinking as a patient first, but how did that diagnosis impact the way you're practicing medicine?
You know, I think it's probably hard to measure all of the ways, but the ones that
Yeah.
come to mind are I remember very vividly what it's like to be on the receiving end of
Mhm.
negative health information or what, is perceived as
Mhm.
negative initially. And so the words that we use when we give someone a diagnosis can really
Mhm.
make or break their first impression and how they see this in their life moving forward. And I don't feel like I would have understood that as well if I
Mhm.
hadn't felt it myself.
Yeah.
I think if I'm diagnosing someone with now high cholesterol or high blood pressure or type 2 diabetes or even prediabetes, the way that I frame it and the
Mhm.
information that they get in those first 10 minutes of the discussion really sets up how they can initially, create that first mind map of the trajectory of their life. And so I'm
Mhm.
really intentional with the way that I do diagnoses and I make
Mhm.
sure that that person has time to let it sink in and then ask questions, especially
Mhm.
those first limiting beliefs that pop up, right? Like
Yeah.
with me, with the type 1 diabetes, there were a
Mhm.
lot of things, but I thought, oh, am I going to be able to make friends? Or,
Yeah.
is there something wrong with me? All
Right.
these things. And I think that we think that, is it my
Mhm.
fault? Was it somebody else's
Yeah.
fault? And so
Mhm.
having time in the initial kind of the conversation or consult
Mhm.
to tear down any limiting beliefs that pop up immediately is so important because if
Mhm.
not, if you don't catch it during your short conversations with patients, then they
Yeah.
could go years thinking that they can't reverse their prediabetes, and that's
Right.
heartbreaking. So
Yeah.
I think that that piece is really important. And
Mhm.
then in medicine, it's interesting. We're taught to, and you've probably heard this, we're taught to kind of ask yes or no questions so we can get all the
Uh-huh.
information as fast as possible. But that's so hard because then the patient
Yeah.
doesn't feel heard or like they got to
Yeah.
share their story. So I do the opposite. I ask a lot of open ended questions, and it's
Uh-huh.
amazing what people will tell you that might not have come out just by
Mhm.
letting them. kind of talk things through. So those are
Yeah.
two things that come up that are really important to the way I practice now because of my personal experience.
Yeah. That's really true. I was recently in a conversation with uh, a family member with who got diagnosed with a little bit of a chronic issue, and yeah, just you saying that, how you phrase the diagnosis, and all made me think of like how that physician was talking to was saying, well, there's nothing you could have done to prevent it, or this is something that, is a unfortunate coincidence, or, the way you frame things and the way you tell a patient can take that guilt off of them, right? Take that guilt off of them so that they don't feel like they are the problem and that that diagnosis is because of them, right? We take that, as you were saying, you felt broken. Sometimes we take that diagnosis onto ourselves as a part of ourselves, and we can't separate ourselves from the diagnosis. And then that's when our mindset sometimes just goes downhill, right?
Absolutely. Yeah. Yeah.
And
That's so well said.
And so I feel like it's so great that you have picked up on that and set yourself apart in that communication. And I hope that others do that too when they communicate, so that we can really empathize with the patient and take that burden of guilt off of them and allow them to be a part of their healing process in a way, right? Instead of just you're part of the problem.
Yeah. And here's a list of all the action items, without that space to kind of let it sink in.
Yeah.
Yeah.
Yeah. So, how did your shift in perspective when dealing with the chronic disease occur? And how did that happen with you? Because, from 13 on.
Yeah. Yeah. I think what you just said actually is reminiscent of my answer is that if you have a diagnosis that you know you will have for the rest of your life, that's kind of a unique situation. I think autoimmune disease is one where people are standing in that position often, not always, but it's hard to grasp that. And it makes it very easy, especially when you're in your formative years, to have a diagnosis, to not wrap yourself into that. And
Mhm.
I was at a conference for young adults with type 1 diabetes in college, and the speaker asked us, it was all, young adults or kind of older teenagers with type 1, asked, who would you be if you didn't have type 1 diabetes? And we
Mhm.
were supposed to journal about it, and then we are going to share with a small group or something. And I just remember thinking, I actually don't know. And that was really scary. It was like at that point in my life, I had set so much of myself up, my eating habits, my exercise habits, the career I wanted to have, all these things, in alignment with
Mhm.
trying to figure out how to make diabetes work in my life, that
Mhm.
if it wasn't there, I don't even know what identity I would have. It was so
Mhm.
much of a part of me. And I think I still in this fight or flight state of figuring out how to feel safe and healthy in my body.
Yeah.
But that was a really big shift in my mindset because I thought, oh, that's not going to work. I don't want to have this life that's wrapped around diabetes. And it
Mhm.
took me then kind of years, maybe after that realization, to unravel some of it. But
Yeah.
it's not, I don't want to just look at all the exercise plans and then pick the one that's perfect for type 1 diabetes. I want to figure out what kind of movement I love and then figure out how to make my blood sugar with type 1 diabetes work around that. And
Yeah.
same with career and friends and schedules and all these things, it's just
Yeah.
figuring out who I want to be and then figuring out how to make type 1 work. And we live in this
Mhm.
world where we have amazing technology and different insulins.
Mhm.
And it's so
Yeah.
possible with learning about it.
Yeah.
It's not easy,
Yeah.
but it took that, it's that shift is I want to be
Mhm.
me first. I want to be true to who I am first. And then I'll,
Mhm.
I'll figure out the diabetes thing and I'll make it work. And that was probably years through college into the beginning of med school trying to sort that out. But now I'm in a
Yeah.
place where I feel very much that I'm me. And
Mhm.
if my diabetes disappeared tomorrow, I'd still very much know who I am, which is grounding.
Yeah. 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 It's not, you don't want to be constantly tied to just, this is my disease, this is who I am. instead it's just something you deal with and something that you're um, having to do, but it's not who you are, right?
Right.
Yeah.
Yeah.
And yeah, that's the beauty of today's technology is there's so many, new continuous glucose monitoring systems and better ways that, people can have better access to controlling their blood sugars better and things like that too. So hopefully, a lot of people have access to that too. But how can you provide and how can or providers incorporate better strategies for caring for diabetic patients from your perspective?
You know, this is so hard because there's not I don't think there's one right way to do it or one right answer.
Mhm.
I think that we have to acknowledge as providers that in our role, even at the practice I am, where I have much longer than traditional appointment times,
Mhm.
I do not have enough time with a patient to answer all their questions,
Right.
and really humbled into that there's
Mhm.
so much knowledge that we cannot verbally tell them in an appointment. And I
Mhm.
think that if you have the means to provide resources that are trustable, that are effective or helpful,
Mhm.
that's really, really important. I remember when I was in my residency, my internship, I had a patient who was diagnosed with type 2 diabetes, and I did my
Mhm.
due diligence with our 12-minute appointments. And a couple, maybe months later, she came back and she had found on YouTube a video about a grapefruit diet and just ate grapefruits for a week. And it was like, I didn't give her enough nutrition information. And so she went to find
Right.
it and ended up, in a place where she, was not feeling great uh,
Yeah.
after that. And so it was just really humbling we have to
Mhm.
understand that to learn to live a healthy life with any
Mhm.
form of diabetes or really any chronic disease, there's
Mhm.
so much you have to learn that we can't give a patient. And so if we're
Mhm.
not providing, evidence-based, clearly communicated resources with actionable steps for patients, they're going to
Mhm.
find them now on their own.
Yeah.
And I think that's our responsibility. So it's
Mhm.
really, really just like optimizing your handouts, and that
Yeah.
sounds so silly, but that's so important because
Mhm.
otherwise there's a whole world of Google and ChatGPT, and we're going to get lost in the details. And then it's easy to box ourselves into something that's not in our best interest.
Yeah.
And a lot of times
Yeah.
as providers, those things were not even taught,
Yeah.
depending on your training program.
Mhm.
And so, finding out those resources or doing
Mhm.
more referrals to your diabetic educator, nutritionist, or whatever it is, but just
Mhm.
understanding that they're going to need a lot more than we can give them, I think is
Yeah.
important.
Yeah, I think um, key thing is good resources
Mhm.
because there's a whole Google out there, and that's the problem. And yeah, if we can educate ourselves on good resources, then that's what we can provide for others. But that's the hard part is are we really educating ourselves on good resources for the patients? So that's a really great tip that you're talking about. Um, and so how did you choose like primary care, but the direct primary care route? I know you mentioned because of longer visits, but how did that come about?
Yeah, I had heard about this model
Mhm.
back in medical school, actually. I was able to do a rotation with a physician who had a direct primary care practice, and that was
Mhm.
really nice to see and kind of work in. And to take a step back for those of you listening that don't know what that model is, it's
Mhm.
essentially a membership practice where patients with really high deductible plans or emergency insurance only, or just by convenience, choose to pay a monthly fee to a clinic where they have access to the physician. And each clinic is a little bit different how that
Mhm.
works. Actually, some employers will buy this for their employees. So there's a lot of versions on kind of how people sign up for it. But
Mhm.
it's kind of like a gym membership because within that month, you can access your physician. My patients, they can schedule with me kind of unlimited appointments that they would like. There's an add on fee if they want to do a much longer lifestyle medicine kind of optimization, visit that may be 90 minutes. Their labs are cash based, but we're able to get really affordable labs when we collaborate kind of with a group practice for Quest
Mm-hmm.
or LabCorp, some of those bigger labs.
Mm-hmm.
So they'll pay a low cash fee for labs, and then we'll do unlimited appointments. And my patients love to message me too for things, that happen. If someone's got a cold, we typically have same day appointments, which is amazing. So it really kind of puts the patient in a place where they're really supported by their provider, which is so helpful if you have
Mm-hmm.
high cholesterol and high blood pressure and prediabetes and you're trying to figure it out, that
Yeah.
additional support can make a really big difference to your health. So
Yeah.
I love that patients who find us typically are the ones that want to use us in a way where they're, growing through things and have a lot of
Yeah.
questions. Not everyone does. But
Mm-hmm.
it's really nice to be able to offer that and then get all their questions answered. It's not unusual at the end of an appointment where all my patients don't have any questions left. We've gone through the 7 that they brought in, and then they feel, whole and complete as they leave, like they were taken care of. And I think that relationship we can build, because I have the time to do that, is really nice. So direct primary care I got into because I had experimented a little bit with different types of
Mm-hmm.
practices right after my training.
Mm-hmm.
And I worked in a cash only practice that was through a national company. And it was doing specifically lifestyle medicine, so really health optimization. So people would have their own primary care and specialists, and they would come to us for the lifestyle piece. It
Mm-hmm.
was it was a great practice, but it was incredibly cost prohibitive for most people. It was very expensive.
Mm-hmm.
And that was hard for me to sit with. I love the care and the outcomes are amazing, but it
Mm-hmm.
wasn't what I wanted to do long term.
Mm-hmm.
And then I ended up starting my own practice that I had for a year. And that was really great. I was able to keep costs much lower because I could keep the overhead of the practice very low. However, over time, I kind of got to a place where I was doing all the administrative work and
Oh,
all the
yes.
physician work, and I was ready to either hire on or stop taking new patients. I wasn't sure what to do. And I got a call from someone I had known kind of previously at
Mm-hmm.
this direct primary care clinic, and they had a provider leave who did a lot of the lifestyle medicine that I do, and they were looking for
Mm-hmm.
someone to come in and take over. So we kind of merged them together, and now it's Doc Healthcare in Central Texas. But I love it. The group practice, I think, is so much better. It's really nice to have other physicians to talk to
Yeah.
about, consult patient cases, et
Mm-hmm.
cetera. And then a team. We've
Yeah.
got nurses and front desk, and all that's really important.
Yeah, for
For having it.
sure.
So.
Yeah. And so how, in a way, like, could you compare it to like um, regular primary care to direct primary care? Do you feel like your patients are in with chronic diseases are having a more positive outcome than in a normal setting?
Yeah. We at this practice, we have
Mhm.
not measured it. So I can't speak
Mhm.
to statistics.
Mhm.
Um, I think that would be a great thing to do, long term,
Yeah.
we kind of get our numbers
Yeah.
there and I'm there a little bit longer. But
Mhm.
do I feel like it? Yes. And of course I'm biased because I put myself in this. And so it's definitely coming, from my own perspective. But I think I have patients tell me that they feel supported more often.
Mhm.
I definitely have people who are able to get their, blood sugars lower, where they're able to come off of a medication more
Mhm.
often. And I have a lot more people interested in movement and nutrition and sleep quality and stress management. And I think just statistically, we know if we're incorporating those things into a treatment plan, then outcomes are better. So
Mhm.
that is my assumption. Uh,
Yeah.
but I do feel like people enjoy the practice that we have,
Mhm.
and their health outcomes, are up to them, but they've got the resources, to help them, which
Mhm.
is where I wanted to be, being able to answer those questions that I couldn't get answered as a kid.
Yeah. Yeah. And it's such a great thing, what you're doing. And I love how you said you wanted to make it a little bit more accessible. And so that's why you chose more of this direct primary care route, or this particular version. Do you find that direct primary care going forward can be more accessible to more of the population? Um, given that, without insurance or, other Medicare and things like that, that other people usually rely on. Because I feel like direct primary care is becoming really popular or more prominent on
Mhm.
the scene. But I'm just wondering about the accessibility long term. Just like what do you feel about it?
You know, it's such a good thought because it makes me think this is kind of a micro question for the macro,
Right? Yeah.
all healthcare question, which I
Yeah.
don't fully know. I
I
mean,
know
there's a lot of room for
exactly.
growth, certainly, and a lot of great
Yeah.
patterns out there.
Yeah.
It's really challenging.
Hmm.
I see direct primary care model as a
Hmm.
really great option for a certain group of people. And
Hmm.
if you have Medicare or Medicaid, probably going to a practice, where you're going to be able to use those resources is the most cost effective option.
Hmm.
A lot of the patients that I saw at the clinic I worked at in medical school, and then we now have at our practice, are small business owners, and
Hmm.
they get their health insurance through healthcare.gov,
Oh,
or they are purchasing these really, high
high
deductible
deductible.
plans with an
Hmm.
$8,000 deductible
Yeah.
before their prescriptions are covered or before they're
Yeah.
able to see a primary care doctor without paying hundreds
Hmm.
of dollars. And for them,
Hmm.
this makes sense, and it's a
Yeah.
really affordable option comparatively.
Hmm.
So it kind of just depends where you are. If you have an
Hmm.
employer that's got a really strong health insurance plan where
Yeah.
you don't have a high deductible and
Hmm.
you've got, low copays, and you have access in your town or city to doctors under that you really
Hmm.
enjoy and work for you, that's probably going to be the most affordable bet long term.
Hmm.
But I think
Yeah.
we have this health insurance access challenge still. It's
Hmm.
miles better than it was when I was even in school. Um,
Yeah.
and I use healthcare.gov for my own personal insurance, and I'm really grateful to have that as an option.
Uh-huh.
But it's still the monthly cost
Yeah.
of
It's
using
quite
it is still
expensive.
very high. Yeah, so
Hmm.
we're perfect for that demographic.
Yeah. Hmm.
And then we've also seen a lot of small businesses who want to
Hmm.
offer health insurance to
Yeah.
their
Employees.
employees, but
Hmm.
they can't purchase it in a large plan like
Right.
a
Hmm.
or
Yeah.
health option because it's so costly to the business and their overhead.
Hmm.
So this is a great option for them to offer their employees as well because it gets
Hmm.
them covered. It gets them their sick visits that they need so they can get better faster, and get back to work,
Yeah.
preventative health. But
Hmm.
it's a different option. And then there are a lot of emergency only plans that are a lot more affordable that people can purchase on top of it. So it's kind of an interesting way to make it work.
Hmm.
I think for this bubble, it's going to be the best option, probably long
Hmm.
term until we change healthcare as a whole or what's available
Right.
to people out
Yeah.
there. But I think from the physician side, these
Hmm.
practices will continue to grow because it's
Yeah.
challenging to have a small group practice and take health insurance. You almost have to hire a billing team, in my
Yeah.
experience, in order to
Yeah.
make it work. And so
Yeah.
it's a way for physicians and smaller group
Hmm.
practices to thrive and have a business that works where they're not
Hmm.
burnt out. That's
Yeah.
another issue that comes into
Yeah.
it, but it
Bought
creates a
out by
great,
hospital systems or
yeah,
need to be bought out by hospital.
yeah, or have to
Yeah.
see 40 patients a day, in order
Yeah.
to get enough copays to keep the lights
Hmm.
on. That's really hard.
Right.
And so,
Hmm. Yeah.
then we're not showing up our best, or I in that field, in
Yeah.
that realm, I wasn't showing up my best. I can't speak for
Hmm.
everybody. So
Yeah.
that's, I think it's a good balance on both ends.
Yeah.
It's at least the best I can find. I've been tried to be very
Hmm.
intentional about it.
Yeah. It's a tough discussion, and it's something that's like, needs a lot of work. And I mean, I think probably everywhere in the world there's a lot of things that can be improved
Yeah.
in any aspect of medicine. But yeah, I mean, it's definitely a lot of work in progress because I feel like, access to healthcare, when you look at different, socioeconomic demographics, there's discrepancies across the board. And then when you think of these opportunities with direct primary care and these physicians and providers like you who really care and delve into each patient's diagnosis, symptoms, questions, and spend that time, it feels like, wow, how can we get this access to a broader population, because could that make a difference in the health of the population as a whole if you're able to do a little bit more time and management? I don't know. Oh, that's a question to think about
Yeah.
or comes across, but.
Yeah. Yeah. No, I think there's definitely something to that.
But yeah, and so what challenges have you faced as a provider or that have made you into a better provider?
A long list. I think it's, I was thinking of this too. I think it's when you practice or even just going through training, practicing
Mhm.
medicine art. And I think I grow or am humbled by something weekly, monthly, it's layers and layers of growth and learning about life from other people's
Yeah.
experiences. And I think what I've learned, gosh, to answer this from a more personal perspective, what I've learned is I think when we go through our medical training, it's really competitive, and,
Mhm.
and it can be so important that we get the knowledge that we need, to show up as good providers for people. But I think that it can be really, we can sometimes get lost in our why, is kind of
Mhm.
why we're there. And we talked about this a little bit on our intro call, but I
Yeah.
feel like for me, I went through and I felt like there was one path and it was kind of like ride or die. You either got it, you made it through all the tests and, accepted all the pieces, and then you get to the end goal or you didn't. And that was like all I could see, and that
Mhm.
was so, now looking back, there's so many ways to make your travel
Mhm.
or journey into medicine work. Um,
Mhm.
and I didn't realize that in the beginning. And
Yeah.
I think that I was a lot harder on myself maybe than I needed to be. And we get into this place where we're constantly, we have to have this score on this test or get,
Mhm.
this many interviews to this residency, and all these like numeric ways that I learned to judge myself for so many years, that I brought that into the beginning of my career, where before it was
Mhm.
judging myself by my GPA or my board
Yeah.
score, and now it's my salary or how many days per week I work, or
Mhm.
it's always like trying to prove my value or my worth
Mhm.
in medicine. And I
Yeah.
think I think now, years out of training, is that if you have the knowledge that you need to help people in an evidence-based way, and you really
Mhm.
care about the people that you're helping, that's what matters most. And
Yeah.
judging myself by, is my salary average for my training level, or should I be working 5 days a week, or is it okay if I don't ever take call, or, all
Mhm.
these things that I feel
Mhm.
like I'm still pulling back layers of. I just want to help people, and that's where I'll get my fulfillment and set my life
Mhm.
up in a way that works for me. And all
Yeah.
those numbers aren't important.
Mhm.
And it's crazy to say that now, because if you had talked to me 6 years ago, all those numbers were like lived by, like
Yeah.
that was everything. And it's so interesting
Yeah.
that now they're not even on my radar anymore as much.
Yeah.
It's just,
Yeah.
so I think that has been a huge challenge, was just learning, what is my why? Why am I really
Mhm.
here? And I feel lucky because I had this great story I could keep bringing myself back to. Of, okay, I
Mhm.
was patient, I had a lot of questions I wanted answered.
Mhm.
I wanted to feel more empathy, and I wanted to have, more understanding of the mindset piece of health. And that's what I'm here to serve people to do now. But
Yeah.
if you can't like cycle that back, and I had to repeat it a million times before I really got out of that
Yeah.
place of judging myself by all the numbers and
Yeah.
accolades.
That's really important because, yeah, we get lost in the itemization of our life versus like what is really the fulfilling, meaningful part of purpose driven, passionate part of our life. Instead of just itemizing, I've checked this off, I've reached this, I have gotten this amount, like you were saying. And so, and yeah, that's something we can all kind of relate to, how we all kind of get carried away with those types of things and lose what life really kind of means, right? What is life all about, and what brings meaning to each of our lives? And that's kind of what we have to focus on, right?
Yeah.
Um, and what have you learned that you can pass on to encourage other female providers?
Oh, this is good. I think I went to medical school in South Mississippi, And I think the year I was in medical school was the first year there was an equal amount of female and male students, which was really exciting and cool to be a part of. But a lot of my mentors and attending physicians in South Mississippi were male. There, I had very
Mhm.
few female physicians as role models until I came to Texas for my residency and internship. And so I felt a lot like I was trying to make myself into maybe a version of me that was less me. I'm
Yeah.
pretty feminine and girly, and that
Uh,
kind of like, oh, I don't want to wear pink because I don't want to seem like I'm not, into
yeah.
science or something.
Mhm.
Like what I don't even know what limiting beliefs you get from that. But
Yeah.
I very much I think I went through trying to make myself kind of like a very rigid and structured and masculine in
Mhm.
the kind of the general energy of the term. And I don't think you have to do that, and I think I just thought I had to do that.
Right.
But also, I think in medicine, as a woman, it's
Mhm.
hard. I mean, it's hard to be really outcome based. Like, I'm so
Mhm.
fortunate every month when I have my period that I do not have to see 25, 35 patients a day. Because if I was on my period trying to see 25, 35 patients a day, I don't even think I could be present fully. I'd be like a robot in there trying to pretend to have empathy when I'm really just, needing to lay down. Like all the, it's just, I don't think I could do it. And it's amazing the women that do it. I'm so impressed by that. And it's wonderful. But I don't think we have to push ourselves to be robotic or if it
Mhm.
feels that way. And often maybe we do feeling like we have to keep up or I think for me, I would say just figure out what you want that makes you feel good and you're healthy and then make medicine work around that. Like don't
Mhm.
just like the diabetes thing. It's just amazing
Yeah.
what diabetes just taught me.
Mhm.
If you don't let like if you weren't a doctor or you weren't a provider anymore, who would you be? You have to have that
Mhm.
first. And then
Right.
wrap your career around who you want to be. Don't
Mhm.
wrap who you are around your career. Otherwise you kind of get lost or
Mhm.
I lost myself a little bit.
Yeah.
So that would be my best advice is just feel like you can be you and you can be soft and feminine and you don't have to have if you want to. You don't have to have
Mhm.
super rigid schedule or work
Yeah.
all these hours. You can work less if
Mhm.
you want to work less. Right now, I'm not full
Yeah.
time, and I don't have kids.
Mm.
I'm just doing it for me, so I can work
Yeah.
on my own health. So I can do other projects that I want to do. I'm doing a lot with
Yeah.
education and resources, because that's
Uh-huh.
what I want to do. But
Yeah.
it's just I think we push ourselves too hard sometimes and don't let
Mhm.
ourselves just show up and listen to what we
Mhm.
actually need to take care of ourselves. So that was
Yeah.
long-winded, but
No, that's really, I love that answer because, and I love that perspective of that answer that you've shared because it really brings to light that sometimes we like stereotype things and we're putting things in a box, right? And even just as you said, we feel like we have to perform just like the other counterparts in your class or mentors or attendings and perform exactly like them. But that's not how life is. We don't have to be exact replicas of other people, right? We're not going to be like that. We're not going to be an exact replica. And um, even with this whole like podcast, medicine, motherhood, missions, it's like so many different aspects of what I'm passionate about. And, you know, when people become moms, that life changes and it doesn't necessarily, I think, like even in my previous podcast, I was talking with someone else about your journey doesn't end or begin just with one specific life event or diagnosis. It continues on and you just kind of find different branches of the river to keep flowing through, right? And yeah, I mean, I like that perspective that you shared. It's very important because we can definitely just feel like we have a identity in just our career or what we're doing or what we're about, and our diagnosis or anything like that, but and completely lose the purpose and passion and meaning of what our whole life is meant to be and or want it to be, right? Yeah. And So, what advice would you give others who face that ongoing health challenge in their lives for chronic disease patients? Or
I I think so often in my life today, I am really grateful for having type 1 diabetes, and that sounds crazy. I mean, and it kind of is, but that's the perspective that I choose now,
Mhm,
is that I have learned so much about life in general through type 1 diabetes as a challenge.
mhm,
It's something I have to manage every single day, and for those of you that don't know a lot about it, it's definitely something I think about many times a day, trying to balance my blood sugar in relation to different things I do or eat.
mhm.
And and it's always there. It's this kind of persistent challenge, and it has taught me so much about dedication to something. It's taught me to get back up on my feet. It's taught me not to quit. I mean, if I could have quit type 1 diabetes, I would have 100 times by now. It's
Mhm.
really created a lot of persistence in my ability to understand that you can keep trying and figure things out.
Yeah.
And it's taught me a lot about life. And I think that in life, there's this saying, and my family says, I don't know if other families do. It's like everybody's got something. It's like
Mm. Yeah.
there's going to be challenges, and that's kind
Yeah.
of what makes life meaningful.
Mhm.
Is that we have kind of a mountain we have to climb. We get to the top, and then the
Yeah.
next thing is the next mountain, and that's
Yeah.
life. And so this is just a big mountain that I've had to climb, but it's taught me so many lessons that I am so grateful for. And I'm
Yes.
very healthy right now. I've got a great understanding of what type of diet works for my body so I can keep a healthy BMI, and what type of movement makes me feel good and gives me focus, and got all these things that I've learned because I've had to, from
Mhm.
diabetes. And I feel like it's actually set me up for more health than I probably would have had without it, long term, just because it's pushed me to learn these things. So
Mhm.
that's my perspective. So my advice would be find your silver lining. If it's hard and it sucks, I'm sure at times, and it's something that you just feel like maybe you've failed at a lot, or you have a habit that's contributing to not feeling good that you can't seem to get past. Just you keep trying, you'll figure it out. But find the silver lining, and if you can find a positive mindset about it, it just makes it easier. Because
Mhm.
I think you can get yourself into a place where you could do everything right, for your chronic disease, and you could have all these perfect outcomes. But if you feel like you're broken, or you feel like there's something wrong with you, or you go to the restaurant with your friends and you don't order any food because you don't want to mess up your blood sugar or cholesterol or whatever, and you are then saying like, oh, this isn't fair, why can't I be like everybody else? Then your life is never going to feel good. You have to feel good about the disease in order to make it work. Otherwise it's just going to be this mindset struggle on top of perfect outcomes, which doesn't feel good either. So my best advice is to find the silver lining, figure out a positive mindset, do that first, and then figure out how to take care of yourself. And in that order, it's much easier.
Yeah. Well, thank you so much, Hannah, for this conversation and for your time. I really appreciate it. And I know that those listening will definitely gain so much knowledge from this and learn that challenges are not there to just, you know, create a burden and a burden of guilt, but that let's learn from it and hopefully grow and hopefully work in a positive way despite those challenges. And so, thank you so much for all of your input, insight, and knowledge. And thank you. I appreciate your desire to help people, and you're so passionate about really doing the best for others. And so, I really appreciate that too. Thank you so much.
Oh, thank you. I love that you're doing this. I think this is a gift to the world here, what you're putting out there. So thanks for putting this together.
Thank you so much. And thank you all so much for listening. I hope that you continue to spark hope wherever you go and shine. Despite the challenges you may face in life, always remember that there are a community of others around you who may be facing similar things. Find community, find support, and spark hope with those around you. Thank you again. We hope that you will listen again next time. Thank you. Thank you for joining us on this episode of Medicine, Motherhood, Missions. We hope you found inspiration, insight, and a sense of connection in the stories we shared today. If you've enjoyed today's episode, be sure to subscribe and leave us a review. Your feedback helps us reach more listeners like you. Follow us on Instagram for updates, free downloads, and to join a community of like-minded individuals passionate about making a difference through medicine, motherhood, and mission work. Remember, you're not alone in this journey. Until next time, keep sparking hope, keep healing, keep nurturing, and keep making a difference. This is Johanna signing off from Medicine, Motherhood, Missions. The medical opinions expressed on this podcast are for the informational purposes only and should not be considered as medical advice. Always consult a licensed healthcare provider for personal medical questions or concerns. The views expressed by guests are their own and do not necessarily reflect those of the podcast host.